Good morning, everybody. Welcome to our very first BC Rural and First Nations Health and Wellness Summit. So excited to have everyone join us here. We see we have a lot of people online across the province. This is a new experience for us all, and I look forward to sharing the day with you. My name is Kim Williams. I am part of the team at the Rural Coordination Center of BC, and look forward to sharing these 2 days with you. I would like to start the morning by introducing you to Brianna Dick and Shauntelle Dick-Charleson from the Songhees Nation. They will sing for us as we wait for Elder Roberta Price to prepare a welcome for us. So thank you, Brianna and Shauntelle.
Hi, Squatchel. Good morning, relatives, family, friends. As you heard, my name's Brianna Dick, or I go by Brianna Bear as well now. My gifted name is Se'ehia. I come from the Songhees, Lekwungen speaking people in Victoria, BC, and then I have roots to the Kwakwaka'wakw Nungi's people up in Alert Bay through my mom. My family is Lahikalat, Skip Dick, Linda Dick, and then my father is Samet David Dick, which is my roots to the Victoria Songhees Lekwungen speaking people. And then my roots to the Namgis Kwakwaka'wakw people is through my mother's family, which is Norman Seaweed, the late Beverly Williams, and my mom, Hatwina Pulukwa, Leslie Seaweed. The Eihlia loosely translates to older sister, which actually comes from our family here in Victoria, from our Wasanich side. But I'll let my younger sister introduce herself.
Hi everyone, Uklexish Hupkosta Ashwiat Soup, Siathiat Lekwungen, Mamathni Shauntelle. Well, hello everyone. My gifted name is Hupkosta, which comes from the Nuu-chah-nulth territory, which I have shared with my late great grandmother, and it loosely translates into sunrise. And my mother is Chamatuk, and her given name is Joy Charleson, and I am from the Heshquit Songhees Nation, and my other gifted name is I was going to say Brianna's name, Cia, which loosely translates into younger sister. And yeah, so we share the same dad, and we have different moms.
And it's an honor for us to be here this morning to share the virtual platform with you. The song we're going to sing today is one by our uncle Yahwelipin Bradley Dick. He's also from the Songhees Nation as well. And it's a woman's honor song. It's one he created about 2 years ago now. And you'll hear some words in it that says Haichka Siem, which in Lekwungen means thank you in our language. And then you'll hear Sahwen. Sahwen is how we honor the matriarchs in our lives. The grandmas, the mothers, the aunties, the sisters, as well as the younger ones who are here and the younger ones to come. And so we thought that this would be a good song to start off because it has a really beautiful beat, and we hope that through this you hope to get what around you this morning. So we take a chance to think about that, and we just really raise our hands and say thank you for having us. So Oh, oh, ah, yeah, oh, yeah, yeah, wah, yeah, wah, yeah. Oh, oh, ah, yeah, wah, yeah, wah, wah, HCASM. We hope everyone has a wonderful day, and thank you for having us here.
Thank you both, Brianna and Shauntelle, very much for that welcome. I'd like to introduce Elder Roberta Price, who will give us a traditional welcome.
Haichka OCM, beautiful, beautiful song, Shauntelle and Brianna. Really, really honored. So good morning, everyone. My name is Roberta Price. I'm the granddaughter of Christopher and Anastasia Canute and the daughter of Josephine from Cowichan. I'm the granddaughter of Jonah and Mariah Bob from Snuneymuxw and the daughter of Robert Bob Sr. So I'll start us off in a good way. OCM. Haichka, CM, Siaya. Greetings and welcome everyone. As Co-Salish Matriarch and Elder, I wish to give a very warm thank you to all my relatives on the Musqueam, the Squamish, and the Tsleil-Waututh for welcoming me to live in the unceded lands of my relatives, Musqueam, here in Richmond for 40 years now. As Co-Salish Matriarch and Elder, I wish to give each and every one a very warm welcome who live, work, and play, give, and receive service on our unceded, ancestral, and occupied lands of my relatives, Musqueam, Squamish, Tsleil-Waututh. And I want each and every one of you from whatever area you are on in the province to take time each day and reflect and give thanks to the ancestors of the lands that you live, work, and play, and give and receive service on. Thank you, everyone. As taught and guided to me by my beautiful, beautiful elders, had the grace to work with close to 30 elders, never dreaming I would be walking in their footsteps today. Really always want to hold my hands up and honor our beautiful Elder Vince Stogan from Musqueam, Elder Bob George from the Tsleil-Waututh, to share their teachings and the teachings of all our elders, that whenever we come together, we must always share a blessing and a prayer for our time together. So I will start us off in a good way. Thank you, everyone. Thank you. Haichka, OCM, OCM. We call upon you, Creator, to bring your many, many blessings down upon this very wide virtual circle here today. We ask, Creator, that you bless anyone who's away due to illness or other obligations. Bless all the ones yet to join us today. Help them to join safely. We call upon you, Creator, to bring your blessings down upon our minds, our hearts, our bodies, our spirits. So when we think our thoughts, they are good, positive, and respectful. When we speak our words, they are good, positive, and respectful. We call upon you, Creator, to bless the food and drink we put in to nourish our bodies on our journeys to wellness and strength. We give you many, many thanks, Creator, as we ask you to continue to bring your blessings of protection down upon all the beautiful people on the front lines who have worked so hard during this pandemic to take care of all the people and other illnesses as well. Bless and protect them and their families, Creator. We kindly and respectfully ask you, Creator, to cover us each with your warm blanket of protection as we journey through this part of the journey of our lives together. Help us all to keep safe in our travels, both near and far, Creator. And we always give you many, many thanks, Creator, as we ask you to bring all of your blessings down upon the ones that are hurting, the ones that are hungry, and the ones without homes, and especially the ones that are hurting, Creator. Haichka, Haichka Ocean, Ocean. Warm welcome to everyone. Thank you so much. Ocean.
Thank you so very much, Elder Roberta.
OCM.
I'm always so inspired by your wisdom and your words, and I really appreciate you taking the time from your very busy schedule. We know that you're very busy in sharing your learnings and teachings all across the province, so we're so grateful and appreciative of you sharing this time with both of us, or with all of us. Thank you.
OCM, thank you.
Virtual sessions do not provide us the opportunity to present you with a thank you token and appreciation of your time and that of both Shauna and Brianna. We will make sure that we have a gift coming to you through the mail to both of you. But thank you once again for starting our morning in such a wonderful way. We're very blessed here today and tomorrow that we have two elders with us for this event. Along with Elder Roberta, we have Sequoia. She will be closing our event tomorrow afternoon. And together this afternoon, both of them will be hosting a teaching session at 1:30. And please take time for those of you that are interested in the wonderful teachings of Elder Roberta and Sequoia this afternoon at 1:30. You can join in with them. Thank you very much. Virtual sessions, as we're going across from BC, from all of our communities, territories, and traditional lands, we even have a few participants from across the country and internationally joining us. I'd like to welcome you all. I'm joining here from the traditional lands of the Musqueam, Squamish, and Tsleil-Waututh people. I invite you, as Elder Roberta did, as you're in your community groups, to acknowledge and recognize the traditional lands that you're on for these days and in the work that you do. Before we get into the morning, and we'll get there right away, and I'll introduce you to Peter, who will be our facilitator, I just wanted to take a quick moment to recognize and thank all the members of our RCC team and the other partners who've come together over these last 6 weeks and worked so hard to bring this summit a reality. We have over 950 people registered for this event and for these important conversations, and it would not have been possible to make this happen without them. Starting with determining what topics we should discuss, what's the best way to ask the questions, developing meaningful evaluation from the beginning, sending out invitations, building and monitoring our registration processes, supporting onboarding of our facilitators, developing collaborative communication channels, building the agenda and all the support tools that go with them, obtaining accreditation, and of course, all the technology tools and support. Everybody has contributed. This is a truly rural experience where everyone has worked together, come together to make things work. I just want to thank each and every one of you that have done that. I also, lastly, just need to thank in advance all of our facilitators who have stepped up to help us work through the sessions this morning and tomorrow. Along with providers and other health partners, we're so fortunate to have healthcare students who are working with us as facilitators. They're all here to help with the conversation, while also helping us with these tech tools. Be kind to them. We're all on this adventure together, and we'll learn as we go. So thank you for joining us. I'd now like to pass our virtual baton to Mr. Peter Lee from Takara Consulting. Peter will be our facilitator for these next 2 days, and he will guide us as we enter conversations with each other. I know he'll lead us with his usual grace and flexibility as we try this new way of gathering together. Thank you, Peter.
Thank you, Kim. Good morning, everybody, and thank you, Elder Roberta, for a very inspiring start to the day. Wonderful to have you all here with us. Again, my name is Peter Lee, and I have the privilege of playing the MC role for the next 2 days, and my role is to try to keep us on track and ensure that we're staying engaged and connected. So thank you for that. I ask for your patience and support during these 2 days if things get a little bit messy, as this is a first for many of us to hold a session for over 950 people in 57 communities. So with that, I'm really going to ask you to help create and emerge new possibilities for rural healthcare as we have designed an agenda that I believe is really interactive, engaging, but mostly focused on creating a very human-centric, relationship-focused conversation. And I invite you to bring fully who you are to those conversations to create what you need to create over the next 2 days. Deepen your connections, create perspectives and conversations that you never thought were possible, and in fact, just enjoy the time together. And I know if we do that, great results will follow. So with that in mind, I think the agenda, Tom, well, you're going to show the agenda. Great. So what you see in front of you, and many of you have actually probably reviewed this in detail given the packages you received. We're going to spend the morning up to basically 10 o'clock having an opportunity to do some context setting, hearing from some guests, and really just laying the foundation for the work that will happen for the rest of the morning, which will include some community table discussions where we use the appreciative inquiry model, and then bringing you back for some panel conversations with some guests, and then getting you into some peer group discussions. And we'll explain those more in detail as we go through the day. The afternoon sessions will kick off at 1 o'clock, and those are open sessions. And as you see, there are a couple of topics for you to consider and hopefully participate in. Okay, Tom, next slide, please. What we also wanted to do to set the tone for the day is quickly show you a word cloud based on a pre-summit question that really asked you the following question. You know, going forward, what changes have been adopted as part of COVID-19 responses that we should stop, sustain, or scale? And what you see in front of you is really the key themes that have emerged. And what we wanted to do is just acknowledge that this is what is important to you. And my hope is that this will set the stage for you to have those real conversations that create that authentic connection and dialogue that ultimately produce some practical results for us going forward. So thank you for participating in that pre-summit question. And just take one quick look before we start actually moving into hearing from some of our esteemed guests. Please, Tom, if you can go to the next slide. The design team has outlined 6 topics that we invite you to explore. These topics are what we are seeing as key pieces that are bubbling up at the provincial level that we suggest would be helpful for you to help steer your conversations and keep at a more kind of strategic level in your dialogue. However, let's be clear that these topics should not in any way constrain you from having the conversations that you believe are most meaningful to you. What we do hope, though, is that these 6 topics are going to be wide and diverse enough to help you, again, explore what you need to explore. So we'll share more about those topics, and there's a whole process built into them for you to play with the community tables and your peer tables as well. Okay, on that note, I'm going to introduce the Honorable Judy Darcy, who will basically present us with some opening thoughts and welcoming comments. So I'll turn it over to the Honorable Judy Darcy.
Thank you. Can you hear me okay?
Yes.
Okay, wonderful. It's wonderful to be here today. Thank you so much, Brianna and Shauntelle, for your wonderful song, and to Roberta, Elder Roberta, thank you so much for sharing your wisdom with us today and getting us started in such a wonderful way. As you know, I am British Columbia's first and Canada's only Minister of Mental Health and Addictions, and I'm joining you today on the traditional territory of the Lekwungen-speaking peoples, the Esquimalt and Songhees First Nations, but I'd also like to acknowledge that all of you are gathering from a number of traditional territories, and I'd like to express our gratitude to all the Indigenous peoples for the opportunity to gather on their lands. And thank you so much to the Rural Coordination Centre of BC for organizing this conference and for inviting me to join you today. This will be quite an adventure, I'm sure. I know that each and every one of you pours your heart and your soul and your professional skills into caring for people in your communities every single day. And I want to extend my heartfelt thanks to you on my own behalf and also on behalf of Premier John Horgan and a grateful province. And I want to give a special shout out for all the work you do on the front lines of mental health and addictions and the overdose crisis every single day. Indigenous peoples and people living in rural and remote areas have been at the forefront of our minds in every decision we've made and every action we have taken together during what are best described as extraordinary times. What an incredible time we have been living through. A pandemic unprecedented in our lifetime, and a fentanyl poisoning that is taking an enormous toll right across the province in rural and remote communities, as well as in urban communities, and especially on Indigenous people. Last month, a staggering 170 people lost their lives because of an incredibly toxic and poisoned illegal drug supply in BC. 550 people have died so far this year. I don't need to tell you, they are our brothers and our sisters, our aunties, our uncles, our friends, and each person leaves behind a family and friends, and often entire communities devastated by their loss. You know, before COVID-19, the overdose death toll was coming down. It was down by 36% in 2019 compared to 2018, still far too high, but we were headed in the right direction, and then COVID-19 hit. Supply chains for the illicit drug supply were disrupted, and the drug supply, according to the coroner, became more toxic than ever, with very high concentrations of fentanyl in combination with other drugs, a deadly, deadly mix. And because of physical distancing, people were more isolated than before, and the number of people accessing overdose prevention sites and safe consumption services dropped in some places by as much as 50 and 60%. So we knew we had to act quickly, and within 2 weeks after the pandemic was declared, the province introduced new guidelines for prescribers and pharmacists so that we could separate people from the toxic drug supply at the same time as we were following Dr. Bonnie Henry's orders on physical distancing to help stop the spread of COVID-19. Today, we are seeing steady growth in prescribers and prescriptions, and we are working hard to improve uptake, especially in rural and Indigenous communities. But we know that there are still gaps in services and gaps in access to care, and we need your help so that more people can have access to safe prescription alternatives to the poison drug supply. We need your help to integrate mental health and wellness addictions care more fully into primary care, and we want to work together with you to do that. You know, when we look back on these last few months fighting the spread of COVID-19, we've seen what a difference each of us has made coming together to do our part, and what a difference we've made coming together as a province. And on Friday, we heard from Dr. Shannon McDonald of the First Nations Health Authority that First Nations have fared better than the rest of the population in BC when it comes to COVID-19 because of the strong response of Indigenous communities. Now more than ever, as we face two public health emergencies, we have to come together in the same way right across BC to save lives from overdose. And I'm asking each of you to help us get this message out, because we are appealing to anyone who uses drugs or knows someone who uses drugs to let them know the drug supply is incredibly toxic right now. And so we're saying buddy up so that you're not using poison drugs alone. Carry naloxone, you can pick up your kit free at any of 1,700 pharmacies across the province. And if you do use alone, download the new Lifeguard app. Once you activate this new app, a timer starts, and at 50 seconds, that app will sound an alarm. And if the drug user doesn't hit a button to stop the alarm, after 75 seconds, it will send an alert straight to 911, signaling a possible overdose. This app has already saved lives. And we want, most of all, we want people who use drugs to know there are safe treatment and recovery options available, that they should connect with their healthcare provider or call 811 to find safe prescription alternatives to the poison drug supply. We know from COVID-19 that when we harness our collective efforts, our compassion and our resolve, we can bend the curve downwards. And my appeal to all British Columbians is that we also have to come together, all hands on deck, to turn the tide in the overdose crisis so that families don't have to keep suffering unimaginable and preventable losses. Last year, Premier John Horgan and I launched something called A Pathway to Hope, which is our 10-year plan for mental health and addictions care in BC. Our primary focus is on going upstream. It's on prevention, on improving mental health and wellness for children, for youth, and for young adults. Because we know that addressing small issues before they become big ones can make an enormous impact on families and on communities. And one way we're doing that, you may have heard this announcement a couple of weeks ago, is with Foundry Youth Centers, the one-stop shops, if you will, where youth can get the care they need all under one roof. A few weeks ago, I was thrilled to announce that 8 new Foundry locations, that's 8 new Foundry locations, are in the works in Langley, Port Hardy, Squamish, Comox Valley, Williams Lake, Burns Lake, Cranbrook, and Surrey. And these new centers are joining 9 that are already open, helping thousands of youth in Kelowna, North Vancouver, Prince George, Abbotsford, Maple Ridge, Pitt Meadows, Victoria, Vancouver, Campbell River, and Penticton. And Richmond and Terrace Foundries will be opening soon. And I am overjoyed that urban and rural and Indigenous youth will now be served with culturally safe services in so many regions across our province. You know, since COVID-19 hit, we went to work quickly to support the expansion of virtual programs at Foundry, at CMHA-BC, and at 49 different community agencies in urban and rural BC that offer mental health and addiction counseling, so that you can talk to a trained professional in your community from home in rural and urban BC. And this virtual care initiative builds on a major investment we made last year in lower no-cost counseling from community agencies, because we believe, as you do, that access to care should not depend on the size of your bank account, nor should it depend on where you live in BC. We know what a huge impact COVID has had on mental health right across BC. I'm so glad to see it's one of your topics for discussion, as is addictions and the overdose crisis. And we can now provide mental health and addiction counseling to people we have never reached before, virtually. And I was really excited to find out that the First Nations Doctor of the Day program with phone and virtual care is also making it easier for people living in rural and remote communities to access the care they need when and where they need it. Now more than ever, people across BC are talking about mental health. The walls of silence are beginning to come down, and that's a good thing. There are more conversations than ever before happening about the relationship between policing and mental health, and that is so important. The issue of both overt and systemic racism in healthcare and in all of our institutions is squarely on the table, and that's a very, very good thing. In my time as Minister of Mental Health and Addictions, I have learned so much from Indigenous communities about both the multi-generational trauma that is the dark legacy of colonization and residential schools, but also about the continuing racism against Indigenous people, including in healthcare. I've also learned that huge barriers can be lifted when healthcare services are culturally based and community-led. And I've learned how important it is to integrate social, spiritual, physical, and mental health in a holistic way throughout the entire healthcare system, and how this shared vision can improve mental health and wellness for all British Columbians. In the Ministry of Mental Health and Addictions, we've been working in close partnership with Indigenous communities and leaders to begin to turn the page on years of paternalism. And last year, our province took a very big step forward when we enshrined in law the UN Declaration on the Rights of Indigenous People. And 2 years ago, on a historic day, BC, Canada, and the First Nations Health Council signed a groundbreaking tripartite agreement that puts First Nations communities in the driver's seat in designing and delivering mental health and wellness programs to meet the needs of First Nations people. And it puts principles like culturally safe delivery front and center. And since then, we've backed that up with funding, 30 million to support that program, 40 million to build and renovate First Nation run treatment centers, and $23 million for land-based healing. You know, back when I first became minister, almost 3 years ago, I visited the Nechako Youth Treatment Center in Prince George, and I sat down and met with some young people there. And I asked them for some advice for me as a minister of mental health and addictions. One young woman took a while to open up, but when she did, she was very clear. She was willing to talk, but she wasn't going to tell me where she was from, because the town was so small and because the stigma surrounding mental health and addictions in her community was so great, she didn't want anyone to find out where she was and that she was getting treatment. We know it is that kind of stigma that forces people to suffer in silence. It is that profound stigma that leaves people to suffer alone. It is that stigma that prevents people from reaching out for help. And in the case of overdose, it's that stigma that means that people die alone. That's why the conversations you're having today and tomorrow are so important, because they're about how we work together to bring better care to people in every corner of this province. Together, we have bent the curve downward on COVID-19. Together, we are bringing down the walls of silence surrounding mental health and addictions. And working together, we must bring down the death toll and save lives from overdose. I am so looking forward to hearing about the ideas and next steps that come out of your discussions throughout this summit. Thank you so much, and I know that it will be a wonderful conference and a wonderful adventure.
Thank you, Minister, for some very critical messages and for setting some very important context for our summit. Really, really clear and compelling. I'd like to now introduce two gentlemen that many of us know very well, Ray Markham and Richard Jock. And I'd also like them to add additional flavor and perspective as we set context for the next 2 days. So over to you, Ray, and to Richard.
Thanks, Peter. I see Richard coming on. You just need to unmute there, Richard. Brilliant. I'll hand over to you, Richard, to go first. I'll follow on your lead.
Thank you, and I want to start by thanking the singers and the elder for starting our discussion in a good way and saying those words that go before all others. And I'm pleased to be joining you from Squamish territory here on the North Shore. And I look forward to hearing as well from Sequoia afterwards. And I was just reflecting on a few things as this started, and on the words from Minister Darcy. And I think back to almost a year and a half ago, well, it would be a year and a half ago, the summit, the first summit. And part of what we talked about at that first summit was the idea of creative disruption. And one of the things I would say now is that we have really several forms of disruption. We have the COVID-19 that has been mentioned. We have the opioid crises, as has been mentioned. And also for First Nations, mental health has been our #1 priority right from the beginning in all of the regional health and wellness plans. And therefore, that has been really an important focus as well. And I would say that this creative disruption has really created as well, a lot of changes and a lot of way to look at things differently. And I would say our partnerships have really been key to these sort of shifts and changes. And I want to thank Ray and the Rural Coordinating Committee for working with us on the First Nations Virtual Doctor of the Day. This has been an important development to make sure that there's some basic access to primary care. And I would say that these sorts of things really will need to be permanent and done in collaboration with other parts of services and other ways of services to make this a complete service. The COVID-19 has also generated the requirement for rapid transport and rethinking various aspects about access to acute care. So there are some important developments in rural and remote in that framework that are important developments and are really pushed by the need to have access within 2 hours to acute care. So these will be important plans. And I would say the challenge that we have in front of us is to take those plans and convert those into reality, because there's still much to do. That we need to push through sort of the immediate circumstances and push to those final answers. Because I would say First Nations have been really waiting for many years and hoping for developments like this. So I would say that that's really the opportunity we have in front of us. I think the recent announcements and discussions and investigation by Mary Ellen Turpel into racism as well is really also an important development. And I would say those elements, I would hope, would push us to a sense of urgency about coming to solutions for these. And I think the topics picked by the organizers are right on in terms of doing that generally. But I think we also need to push further and faster and harder, particularly on the racism issue. I think the other thing I just want to say in closing is that that partnerships have really been the key feature of progress, and that I would hope and think that partnerships will also be really important as we grapple with and push through and come up with the solutions that are needed over the next period of time. I also just want to close by saying that there have been important developments in terms of the primary care network, but I also want to emphasize, and I think some of the recent developments also provide an aspect of focus to this as well, is that First Nations also need their First Nations-led primary care programs as a key way and perhaps a safe haven to make sure those services are provided in a context where First Nations people are really leading that, or governing, and I would say executing those models, those team-based comprehensive models that include elders, include mental health and others. So I wanted to really conclude with that, to say that we need to work together, but also have those distinctions, and the ability to work on those distinctions is really vital and important as we move forward. So with that, thank you very much. I'm pleased to be here this morning, and pass it over to Ray.
Brilliant. Thanks, Richard. I always find it tough to follow on because you kind of really outline things in such a really way. And certainly this is about partnership for sure, from my mind. And, you know, COVID has shone a light on some partnership stuff. And I think Honorable Judy Darcy has kind of flagged the mental health and addictions piece, which has also shone a light on things. But really, this is about the solution of the way forward, which is, I think, that COVID thing. For those of you who don't know me, my name's Ray Markham. I'm a rural doc in the Robson Valley. The communities of Valmont and McBride. That's where I'm beaming in from, the traditional territories of the Carrier and Sim people. I've been there for coming on a couple of decades. And really, you know, I came here because I wanted to be a part of longitudinal relationship-based primary care and just be a part of a team which we have in both communities, which are really just helping people walk the road to better health. I've also been kind of involved in the Rural Coordination Center for over 5 years. And it's kind of interesting, it's exactly the same reason that I'm there, is it's about improving the health of rural people and communities. And the work that we do provincially, I would not be doing if it didn't kind of show up on the ground in some way. To show up in my community, for my patients, for my team in Belmont and McBride. And I think that's really what this summit is about, is actually trying to align that kind of top down and bottom up through partnership to move things forward. So that kind of gets me to why we're here. I mean, why have 950 odd people registered for this at a time, I think, when we're all zoomed out. Lots of video stuff, lots of other things. The summer's going. It's a nice, bright, sunny day here today. We have 60 community tables, 100 facilitators, over 100 facilitators who've given their time and actually stepped into that stressful thing of the unknown. A lot of them didn't even know what communities tables they were going to be leading. And I know our team at the RCC has really shed blood, sweat and tears. Well, not blood, but sweat and for sure tears, trying to put this thing together when we decided to move ahead on this on the 21st of May. So, you know, I can't answer for everybody else, but I know for me, I came here because I know that we can shape the next steps toward better health in rural and First Nations communities in BC. I mean, how do I know that? You know, this partnership approach, which you'd mentioned, Richard, has produced changes. So we kind of met with a smaller group, 250 people, not this kind of larger group, but really kind of this idea of bringing people in partnership. You know, traditionally, when we take a bit of a problem-based approach, we kind of look at the people on the other side of a problem, and we'll get one or two groups together and kind of look at the problem and then blame each other or tell each other what they have to do, or actually more commonly tell the person who's not in the room what they need to do to fix it. And that's not what this is about. This is really about kind of how do we move forward. So look, coming together to decide what are we going to pick up together. And in that case, the people on the other side are actually, they're going to pick the same thing that you're picking up, that I'm picking up. And so I need to know what they can pick up and how they pick it up. And I also then need to know how I pick up in the same way. And that's exactly what this conversation is about. And that's what this partnership work has been about. In the January meeting, there were some really tangible movements. So the First Nations Doctor of the Day, you mentioned, Richard, rural emergency supports, transport stuff you mentioned as well, Richard, this idea of fit for purpose training. So how do we get people trained for rural, from rural, to go back to rural, to provide the right care, including the cultural safety and appropriateness of care, and all of those pieces. One of the big things those have been really tangible movements. But one of the big things that did come out of it was there's a bit of a gap in kind of how is community, so the bottom, the grassroots, which I think is a lot of where we're trying to go here today, connecting with the top, because there needs to be, at the end of the day, a top-down and bottom-up, not only a partnered approach, but a top-down and bottom alignment. And that's exactly what we have tried to do, what our community, that I'm so proud of, the community at the RCC, the team at the RCC has given their heart and soul into creating this space for everybody here to do that, to try and figure out a little bit of the top-down and bottom-up, as well as that partnership stuff. So that's where we are at the moment. I know it's going to work because I know in rural we do the best we can with what we have. We do that all the time. So this is not, I can guarantee you this is not going to be a perfect event with the technology stuff. We've pulled out all the stops to anticipate everything. But at the end of the day, I know in rural we do the best that we can with what we have. And so I trust that everybody here is going to be able to use this time to help shape those next steps that we take together. And then kind of, as you'd said, Richard, it is all about relationships. So really fundamentally, this is designed to try and actually help build people the opportunity to connect those relationships. There is no system, kind of, you are the system. There's not one person pulling the strings of healthcare in British Columbia. It's too complex for that. But each of us has a part to play in that whole thing. And so the idea is coming and bringing your perspective, which is hugely important. Every single perspective here is hugely important. Being willing to listen and being curious. And what we have noticed in our previous work is that strangest things start to happen, that our perspective shifts, and so does that of others. And I think that, you know, when my perspective shifts, the system has shifted in some small way. When 950 people's perspective shifts and we start seeing what other people are seeing and start seeing where we might actually be able to go forward, that's actually the opportunity. So that's why I think that we can shape the next few steps towards better health in rural and First Nations British Columbia out of this work today. So I'm just going to ask everybody here to be curious, bring your perspective and listen, be welcoming, show rural hospitality, because a number of your rural community tables will have provincial leaders coming in, joining your tables. And I'll be honest with you, that certainly when I've had the conversations, one of the overarching themes is a little bit of anxiety about, I'm not rural, so how am I what's the value that I'm bringing? So there's a little bit of anxiety there. So show them rural hospitality, kind of welcome them into your tables. Be strategic, because you're going to find time pressures is the biggest pressure that you have here. So be strategic about bringing your community perspective to the topic themes, to the people you have at your tables, and to the system overall. But most of all, have fun, enjoy, get to meet some new people, get to think about things, get to listen, get to kind of expand your horizons a little bit. And I'm super excited to connect with as many of you as I can over the next couple of days. I'll hand back over to Peter.
Thank you, Ray, and thank you, Richard. Tremendous job of really outlining the design principles of the summit. And I thought you did an excellent job of really summarizing the perspective of share rural hospitality. I think that really sets the tone for us all. On that note, let me now shift over to Megan Hunt and ask her to introduce a few pieces for us as well. So over to you, Megan.
Thank you, Peter. Good morning, everyone. I would just like to thank Elder Roberta and her wonderful and grounding opening this morning, as well as our singers for the beautiful song. I'm situated today on the traditional lands of the Lheidli T'enneh people in the Carrier and Sekani territory. And I'd just like to acknowledge all of the territories that, from what I see this morning on the screen, is over 650 people. As many of you will remember, last year when we were together, just like we started today, just in a virtual space this morning, the important part of grounding our time together and our work in cultural and traditional practices. And so we have the joy of being able to do that again over the next 2 days together and really deepen our connections and wellness through traditional healing practices, to be able to uplift and to ground and to support and to find wellness together. And so I'm delighted that this year again, we have time to spend with our Saulet Laylam group. Over the next 2 days, they'll offer cultural supports and guidance. As many of you know, the Saulet Laylam group is based on Vancouver Island. The Healing House is just magnificent. They have a tremendous team of cultural supports, and they go into community on a regular basis. They've been wonderful supports to First Nations Health Authority, and now with the change in COVID, have been able to really lend in and be nimble and do cultural supports and healings through virtual means. And so today, another way of being able to do that is to offer those traditional supports with Saulet Laylam virtually. And so you'll see up on the screen, the 1-800 number. You're gonna give that number a call anytime between 9 and noon today, and Nola will either answer the phone or George will answer the phone and get a bit of quick information from you and organize for a session. And I'm really encouraging everyone, take that time as you need to step in and step out of your sessions and connect in with our traditional healers and healing group. It was something that we saw last year where more than 60% of our participants on the first day spent time with our healers. And of that 60%, more than 80% went back and did traditional healing a second time. And so we know that traditional wellness is not just good for First Nations, but really has a place and a role in wellness for everybody. And so I really hope that your time with the Salat Laylam group is wonderful over the next 2 days. And we look forward to hearing from many of you about your experiences.
Thank you so much, Megan. One more piece, folks, to end this context setting portion of the morning. And I'd like to introduce you to Adam King. If you attended the January session last year, you'll remember Adam. Adam is from bethink Solutions and will share a little bit around the self and relationship tool that we would like you to experiment with again. So over to you, Adam.
Fantastic. Good morning, everyone. It's a real honor and pleasure to be here. I hope you can see my screen if you can. I'm here in Vancouver on the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh. I have been supporting, I guess, change and transformation initiatives throughout BC in partnership with the RCCbc and the GPSC, working with rural divisions of family practice and their partners to think about how to design primary care networks that make sense in the local context. I've also had an opportunity to work within a health authority, provincially, within a federal organization, and also internationally in a lot of very developing nations. The one thing I realize is, as complicated as it is, the simplest thing is the amount of trust that we can build within the partnerships. And this is why, although it's simple, it's not always easy, because we all hold different worldviews and often we focus on our differences more than our similarities. But when it comes to supporting BC rural and First Nations health, I think it's a real common setting ground that we really want the best for our communities and those that we love, and we're willing to spend time like you folks are today together to try to push that agenda forward. So my job here is really to invite us to do a little self-reflection activity before everyone breaks off into their community groups and then into the peer groups. So this is now an invitation to pull out a piece of paper and or take mental note. Some of you folks may have actually downloaded the participant handbook, and on page 2 of that, there's actually an opportunity to take some notes. So I'm gonna ask everyone to just take a moment to get a piece of paper or to pull up that PDF, which is a fillable PDF, and you're gonna write a couple notes. I'm gonna kind of guide you through the process, and then I really want us to take a moment just to self-reflect and also invite us to think about what relationships we want to really lean into over the next couple days as well. So this is going to be a high-level gut check assessment of our relationships. Now, this is an experiment. This may not work perfectly, but as Ray said, when you do things differently and when you try to innovate, there's always a little bit of a learning curve. So we've done this assessment in person many times, and we've also done it digitally. So this time we're going to do it analog. So you folks are you're going to take out a piece of paper or take a mental note. We're going to go through it. So what we want you to do is to think about the people you work with, or if you're a community member, a citizen, people you interact with within your own community of which you live and work, and think about the people within the various broader, we'll call them partner groups. And you folks are probably well aware of this partnership pentagram plus model, where we'll have kind of buckets or partner groups like policymakers, health professionals, academic institutions, communities, health administrators, and kind of linked sectors. Of course, everyone here is different and has a different network of relationships. So for example, you may not interact with policymakers in your community, and that's okay. You can just answer that. You may be a physician and you may interact with physicians daily, but you rarely connect with folks from academic institutions, and that's okay. We all have a different kind of network of relationships, but to the best of your ability, I want to invite you to think about the few people that you work or interact with from each of these groups. The tool we're going to be using is a very simple visual tool, so it's not complicated. It's essentially a bunch of circles, Venn diagrams that you choose from, but it's been designed to be an intuitive means to measure our subjective, our personal feelings of relationship closeness. So this is all we're looking at, is how do you feel? Not what you think, how you should feel towards people, but how do you actually feel towards the people you connect with? And of course, it's been validated and used to measure this in various different situations. So here's what the tool looks like. So there'll be a bunch of these Venn diagrams, these circles. You'll see, and there's numbers from 1 to 8 that I really want you to focus in on the circles themselves. Now that we're referring to. So let's use an example of healthcare providers. So which pair of circles best describes your relationships with the healthcare providers you work or you interact with? Once again, there may be 0, so you can pick 1 or leave it blank, which is I don't work or interact with anyone. It could be, if you're a patient, it could be once every 6 months you go see a doctor, for example. Or it might be, you know, someone you interact with greatly. If you feel very distant, it would make sense to choose the 2, where the 2 circles aren't really connected. And if you feel very close in your relationships, of course, the number 8, where the 2 overlapping circles are very connected, would make a lot of sense. So it's kind of a visual tool. And then I'm going to ask you a second question about each group, which is, is my screen still being shared, folks? Can everyone still hear me fine? You can see my screen?
Yeah, it's just come up now, Adam.
Okay. And so the second question is really going to be about, you work with them. Okay, wonderfully. So can you, is my audio fine? I'm assuming folks can hear me.
It's in and out, Adam. So just maybe speak closer to your mic if you can.
Certainly. Okay, so then the second question I'm going to ask is, how often do you work with these people? Is it daily, weekly, monthly, quarterly, every 6 months or once a year? So these are the 2 questions that we're going to be asking for each of the different partner groups. The point here isn't to overthink it. The point is to use our kind of intuition and instinct. We don't want to rationalize these ones, so we want to use our fast brain, if you will. And there's no wrong answer here. And this is only for your own self-reflection. So if you could get ready to take notes, you could use that fillable PDF handbook, or you can take notes. Or if you're really sharp, you can even do this mentally. Let's walk through the first one. So which pair of circles best describes your relationship with health professionals? So some examples of these would be physicians, nurses, allied health workers, care professionals, BC Ambulance. Those are examples. So think about this, look at those circles, and try to think about how close you feel professionals group. Okay, we're gonna move relatively quickly. So now I want you to reflect on how often you work or interact with health professionals. Is it daily, weekly, monthly? So just write daily, weekly, monthly, or quarterly, if you do have relationships with those folks. Okay, now we're gonna move relatively quick, so I hope we'll get into the rhythm of this. So think about policymakers. Now I know it's a broad group, but it could be folks you work with if in the Ministry of Health, BC Nursing Union, College of Family Physicians, College of Midwives. You'll see the kind of examples of the partners on the bottom of the page, so I won't list them all out. So think about the folks that you might interact with that fall into the policymakers, and please pick which pair of circles best describes your relationship with them. And then how often do you work or interact with them from this partner group? Weekly, monthly, quarterly, etc. Okay, let's move on. Health administrators. So this is a broad group that would be from most of the health authorities. It's the First Nations Health Authority, Fraser Health, Northern Health, could be from Providence, BC Women's. You'll see the list below again. So think about the folks you work with there and which pair of circles best describes your relationships with health administrators that you work with. And how often you work or interact with people from this partner group. Okay. Now think about academic institutions. So the people that you connect with that might work at a university, might work at a rural pre-med program. They may be teachers, researchers, rural scholars, BC midwifery program, lots of examples that would fall into that academic institution. So just pick the circle that best describes your relationship with those folks. And then once again, how often you work or interact with people.
Adam, we're losing you again.
Just a couple more folks. Describes. Do you have me, Peter?
Yeah, now we lost you for a bit, but you're back.
Okay, this is one of the wonderful things we have to run with the technology. Which pair of circles best describes your relationships with the people you work or interact with from First Nations communities? So this wherever, could be your local First Nations communities, friendship centers, First Nations Health Council. Once again, pick the circle that best describes your relationship, how close you feel to people, First Nations communities, and then how often you work or interact, daily, weekly, monthly, quarterly, etc. Two more. I hope everyone's still with me here. So the description of linked sectors in this model, sometimes confusing for folks or contributors. This could be nonprofits, could be the BC Rural Center, Institute for Health System Transformation, could be industries that have a vested interest in rural health, such as forestry, oil and gas, or mining. So think about whatever folks you work with or interact with that might fall into this sector, and rate how close you feel towards those people in your community from those groups. And once again, how often do you work with them? Daily, weekly, monthly, etc. Okay, the last group here is around just kind of patient citizen groups in your community. So there could be patients themselves, could be folks from the Patient Voices Network, from municipalities, community organizations, or foundations, BC Patient Safety and Quality Council, for example. Which pair of circles best describes your relationship with the people from these patient and community groups? Rate that. And of course, how often do you work or interact with people from this group? So many of you folks, I hope, have taken note on a piece of paper or on that PDF, and or have taken a kind of mental note. I want you to just take one moment to look back over your list, or to think back if you've been mentally following along, and really reflect on if anything surprised you. Which groups do you feel closest to? Which groups, partner groups, do you feel most distant from? I think noticing where we lie in our current relationships is an opportunity to celebrate the relationships we have and we've built in our communities. Seeing where some of the weaker relationships are, I think, are also an opportunity for us to reflect on where we may want to grow into or reach out from, or potentially even in your community session that you folks are going to be moving into right away, to think about which of those specific partner groups that I may be quite distant from, maybe I can listen particularly closely to their thoughts in our conversation, in your community conversations, and try to learn more from their perspectives. And I think for me, this opportunity for self-reflection leads into a great opportunity for self-correction. And this is the learning cycle of those of us that are very interested in supporting our own development, our community development, and of course the system development. As Ray always says, there's no system, we are the system. Kind of my variation on this is that the relationships between us as individuals, as groups, as professionals in whatever capacity, those relationships make up the health system itself. And so that if you work over the next 2 days to actually change and strengthen your relationships with each other, that is how we can and will change the health system for the better. And so the responsibility to a large degree is on us. And you guys have already showed a great deal of willingness to be here today and to participate in this event. And so I honor and thank you for that. And thanks for taking a couple moments to reflect with me on the state of our current relationships. Over to you, Peter.
Thank you, Adam. Always good to see you.
Likewise.
Well, folks, we are coming to the close of our morning session, and I again want to just acknowledge the context setting and thank the Minister Darcy, Ray Markham, Richard Jock, Megan Hunt, and Adam King for setting the tone for us. What we're going to do now is transition directly into our first community table. And as you know, we're using the appreciative inquiry model, which really has 4 key stages. The stage of describing, the stage of dreaming, the stage of designing, and the stage of delivering. We're going to enter that first stage of describing. And you will be shortly going into a new Zoom session, and your facilitators will be there waiting for you. You'll have a lead facilitator as well as a writing facilitator. If they're not there, they will be there shortly, so just hang tight. And if you're running into any technical difficulties, please use that helpline. Maybe we can just put the number again on the chat line, if you can, Tom, and we'll help you with any technology issues. But at this point, we're going to invite you to bring that curiosity that Ray really spoke about, and really the perspectives of reflecting on your relationships based on the exercise that Adam just took us through will be an important piece. So take those reflections, consider how that, shapes the way you want to show up in this upcoming conversation, and encourage you to enjoy the time with your colleagues as you start to get to know and engage in those real meaningful conversations. So on that note, if you can exit this particular summit webinar, move into your Zoom links, and again, any problems at all, please call that helpline, which is now showing in your chat function. We'll see you soon, folks. Take care and enjoy the first session with your community tables.